In this video, we'll discuss about internal resorption. Now, it is very important in the exam point of view as well as for your knowledge and MCQs as well. So, coming on to the definition of what exactly is internal resorption, it is basically an unusual form of resorption that begins centrally within the tooth and is apparently initiated by a peculiar inflammatory hyperplasia of pulp. Now let's discuss the other names. Usually the questions are asked by the name of pink tooth of mummery. Now we will discuss further why is it called as pink tooth of mummery. Also it is called as odontoclastoma. The reason why it is called as odontoclastoma because it is because of the odontoclast cells. Odontoclast cells are basically multinucleated cells that act with the osteoclast and help in resorbing the dentin in the bone. Alright, and then it is also called as internal granuloma. Also we will pick something from here. So chronic perforating hyperplasia of pulp. Now coming on to the etiology, it is actually the etiology is basically unknown. However, the initiating factor can be injury, trauma. It is basically a pulpal injury that leads to an inflammatory response. Now coming on to the classification. Um, yes. So for the classification, it is of two types. One is the internal inflammatory resorption, and one is the internal replacement resorption. Now over here, you will see that there is a pulpal injury that is further leading to the resorption. Also, you will see that the function of the odontoclast cells is very important in this one. So it occurs basically in response to a pulpal inflammatory reaction. So it is an inflammatory reaction, and even when you see it under the microscope, what you will see is you will see chronically inflamed pulpal tissue and numerous inflammatory cell infiltrate, also odontoclast cells. This is very important. You must mention odontoclast while mentioning internal resorption. Then there is also on the radiograph you will see that there is uh, enlargement of root canal, spherical enlargement. Now, in the replacement type, this is usually not associated with inflammatory reaction, so it does not need an inflammatory reaction to occur. To then, in the histopath or the microscopic findings, what you will see is on microscopic examination, you will see that there is fibrous granulation tissue in the pulp. Also, there will be calcified masses. Then in the radiographic features, you will see that it is basically resembling osteomyelitis. So basically it will have moth-eaten appearance. Now let's discuss about the clinical features. Now we have discussed about the definition and the other names, and now we will discuss about the clinical features. Now in clinical features, what usually happens is basically we see that this is localized. Then it can involve the crown portion and it can involve the root portion. Now what will happen is if it involves the crown portion, so we will basically see that it will appear to be of pink color. Now what is actually happening? The resorption is happening, due to which what we see is the granulation tissue starts filling up the the area which is empty now. So due to that reason, there is pulpal tissue inside it. So the crown appears to be pink in color. Whereas if it is involving the root portion, then it will be of normal color and there will be no color change. Okay. Then initially what you will see is it is arising from the central part, so from central part. So you can explain all this here. Also, this pink color is also observed. This is commonly asked question. It is also observed in external resorption. That too of the burrowing type. Now, the involved tooth, it can be vital and asymptomatic, but if it has become severe and it has reached the case of pulpal necrosis, so then it will be obviously non-vital. So you need to mention this point as well. Also, yeah. Uh, Also in the etiology, what actually happens is there are many small resorptive lacunae that are formed, okay, small, and then they all of them they collapse, coalesce, or they diffuse, and in the dentine, so basically they cause the entire dentine to be equally resorbed, all right. Then coming on to the histo. In histo, what we will see is there is irregular lacunar type of area. Now this will have some, it will be either partially or completely filled with irregular dentine or osteodentine. Now the radiographic features are very exciting of internal resorption. Why is it so? Because first of all, what you see is you see a well circumscribed spherical radiolucent area in the dentine, which is continuous with pulp chamber. Now over here, what is interesting is there is communication between the pulp chamber and the PDL space. So you will mention about it, communication. Also, one more interesting fact, what actually happens is sometimes there is this very characteristic appearance. The the root canal, right? It appears to be as something of balloon type expansion in internal resorption, balloon type of expansion. So I hope you can remember it through this diagram. All right. Then coming on to the treatment, if there is internal resorption and we know about it, so what we will do is we will first of all extirpate the pulpal tissue, then conventional endodontic treatment. Also, if the tooth is very perforated or is in a severe condition, if the tooth is perforated, then we will extract the tooth. Now I will just sum up again so that you remember well. Extraction. Suppose I'll just draw one more diagram so that it is easier. Suppose this is something of a tooth and this is our pulp, right? Now what you see is the internal resorption. It basically starts like this. It starts, it starts, it starts. This is involving, right, the crown portion. It can either also occur like this if you see, involving the root portion. Okay, so this is basically internal resorption. Basically, what is it? It is an internal resorption. That is, it will begin centrally. All right. So let me just mark the main things. It will centrally within the tooth. Then this is the keyword. That is, it is hyperplasia of pulp. Then odontoclastoma and pink tooth of mammary and internal granuloma. Now, it is basically an inflammatory response. Then inflammatory and replacement. All right. Here, calcified masses will be seen, odontoclasts. Then this will be spherical enlargement. We discussed it in the radiographic features as well. Over here, it will be moth-eaten appearance. Then it can involve the crown portion, and yeah, the involved tooth is usually vital and asymptomatic till pulpal necrosis has not occurred. All right. Then this is also seen in external and burrowing type resorption. The pink tooth, the pink color. Then histopath, you know it quite well. Just remember to mention irregular dentine, okay, and irregular lacunar type of area. Also, then in this, what we will see is well, some spherical radiolucency area of the dentine, and this is important, and this is quite a nice thing to mention in the exam. Also, this is quite easy when perforated extraction. So I hope I made it easier for you to understand internal resorption. Thanks for watching my video. Do subscribe to my channel.